Welcome back to Fluvoxamine Frontiers, battling COVID 19, where we are unraveling the surprising ways fluvoxamine is making a difference in the fight against this global pandemic. I'm your host, Dr. Soma Rohatgi, and I am thrilled to have Saakshi Sharma for decoding complex science. In our previous episodes, we have explored how fluvoxamine tames inflammation, but today, we are going beyond that to uncover its other talents, like preventing blood clots and protecting blood vessels. Let's break it down simply. Picture your blood vessels as highways, carrying oxygen and nutrients to every part of the body. In severe COVID 19, these highways can get clogged with tiny clots, like traffic pileups, causing serious damage. Fluvoxamine, it turns out, might act like a skilled traffic cop, keeping those highways clear by preventing clots and protecting the vessel walls. How does it pull off these extra tricks? Let's dive right in. Saakshi, let's start with the blood. How does fluvoxamine influence platelet aggregation in COVID 19? And why is this important for patients?
That's a great question, Dr. Soma. And the traffic cop analogy is perfect. Platelets are tiny cells in blood that help form clots in order to stop bleeding. But in COVID-19, they can become overactive, sticking together and hence forming microclots that block small blood vessels. This contributes to complications such as strokes or even lung damage. Fluvoxamine seems to modulate platelet activity, likely through its effects on serotonin signaling. You see, platelets store serotonin, and fluvoxamine as an SSRI influences how serotonin is released or how it interacts in the bloodstream. Research, including studies from 2021, suggests that fluvoxamine reduces platelet aggregation, the clumping process, by stabilizing serotonin pathways. In the Together trial, patients on fluvoxamine had fewer severe outcomes, which could partly be due to this anti-clotting effect. By preventing these microclots, fluvoxamine helps keep blood flowing smoothly, reducing the risk of organ damage.
That's fascinating. Fluvoxamine stepping in to prevent those dangerous traffic jams in the bloodstream. Sakshi, you mentioned blood vessels. So let's talk about endothelial health. What role does it play in severe COVID 19 outcomes, and how does fluvoxamine help protect these blood vessel walls?
Absolutely, Dr. Soma. The endothelium is the inner lining of blood vessels, acting like the pavement of those highways you mentioned. It regulates blood flow, prevents clotting, and also maintains vessels' integrity. In severe COVID-19, the virus can directly damage endothelial cells, causing inflammation and making vessels leaky or even prone to clotting. This endothelial dysfunction is a key driver of complications like acute respiratory distress or heart issues. Fluvoxamine's sigma-1 receptor activity comes into play here. By binding to sigma-1 receptors in endothelial cells, it helps reduce inflammation and stabilize vessel lining. Studies, like those published in 2022, have shown that fluvoxamine can lower markers of endothelial damage, such as von Willebrand factor, which is elevated in severe COVID cases. This protective effect helps maintain those highways, ensuring oxygen and nutrients reach vital organs. This protective effect helps maintain those highways, ensuring that oxygen and nutrients reach the vital organs, which is critical for recovery.
So, fluvoxamine is not just directing traffic, but also repairing the roads. Are these platelet and endothelial effects unique to fluvoxamine among SSRIs, Or could other drugs in its class do something similar?
That's a really thought-provoking question, Dr. Soma. Fluvoxamine does have an edge, but it's not entirely alone. Its strong affinity for the sigma 1 receptor is a big part of why it's effective at reducing inflammation and protecting endothelial cells, as we have discussed. Other SSRIs, like fluoxetine, also have some sigma 1 activity, but it's weaker and less specific. When it comes to platelets, fluvoxamine's influence on serotonin signaling is shared by other SSRIs up to some extent, since they all modulate serotonin. However, fluvoxamine's unique chemical structure and longer half-life give it a more sustained effect, which is crucial in the acute setting of COVID-19. Limited studies, like small trials with fluoxetine, suggest other SSRIs might have similar effects, but the clinical evidence for fluvoxamine, like from the Together trial, is much stronger. So, while others might help, fluvoxamine's the star player in this particular game.
That's truly amazing. Fluvoxamine really is a multitasker in the body's fight against COVID 19. Fluvoxamine is a multitasking city planner, not just fighting the fires of inflammation, but ensuring the highways of our blood vessels stay clear and strong for recovery. By managing platelet pileups and repairing endothelial roads, it keeps the city of the body running smoothly in the face of COVID 19's chaos. Thank you, Saakshi, for shedding light on these hidden talents of fluvoxamine. Listeners, keep exploring with us on Fluvoxamine's Frontiers. Stay curious, science always has more secrets to share.